So I wanted to talk to you a little bit about K laser. K laser is it's a bright red laser. It's a beam of light that occurs at roughly 700 nanometers wavelength. So you can see it with your eyes. And they're taking K lasers and they're aiming them at damaged tissue and healing tissue and inflamed tissue. And they're seeing some healing, increased rates of healing and cellular metabolism and all that. And folks look at the K laser and that 680 or 700 nanometer light therapy as kind of hocus pocus. But there's a reason that that works. And to understand the physiology is to understand a much simpler molecule that pervades our cellular material and even that of plants. And that's going all the way out to what's called chlorophyll. It's the green pigment in leaves. And chlorophyll is a molecule that's held in cells that are capable of what's called photosynthesis. It's making sugar out of carbon and water. And the photosynthetic process is driven by sunlight, and it produces sugar and oxygen. And so if that is how chlorophyll works when it's activated. It makes energy, sugar, and it liberates oxygen. So that's pretty cool. But plants are not the only cells that have chlorophyll activity. There are parasites, fish parasites, that actually have chlorophyll activity too. It's called Oudinium, and it's full of things called chloroplasts. And that parasite feeds itself and generates certain amounts of its own oxygen for its metabolism because of the activation of the chloroplasts in its body. But parasites are not the only thing, and plants, the only thing that actually has a chlorophyll behavior. Amazingly, there's a ton of bacteria that have a chlorophyll or chloroplast behavior as well. And furthermore, some of those bacteria actually live inside of you. The bacteria I'm referring to are called mitochondria. They're little individual bacteria that live inside your cells and have, ever since the inception of mammalian metabolism, these little bacteria loaded with essentially chlorophyll provide the oxygen and sugar for your cells. And they require a degree of oxygen, carbon dioxide and energy and heat and all of that for the metabolism. But what's interesting about this is those mitochondria, those chlorophyll-rich bacteria that live inside each of your cells that produce the oxygen and sugar, those can be stimulated by the same light that stimulates plants and other bacterial chlorophyll. That's sunlight, and that's at 680 nanometers. So what's going on with the K laser and the red LEDs and all that other stuff basically is you're just getting a 680 nanometer or sunlight wavelength that is just bright enough to penetrate the cells, and it goes into the damaged tissue areas and it activates the chlorophyll that is inside the mitochondria, that is inside all of your cells, and it causes those cells to oxygenate and produce sugar and energy and heal faster, and their metabolism picks up, and so wounds, lesions, inflammation, and healing all improved. So it's not really hocus pocus, and the wavelength is pretty specific because chlorophyll that's in the mitochondria and plants is activated at more or less a specific wavelength. Not all sunlight activates chlorophyll. So when you hyper supplement that particular wavelength to chlorophyll, it has the greatest effect. So really what it comes down to is not K laser versus LEDs, but how deep the 680 nanometer light can penetrate. And so that's the reason you're going to pay a certain amount for a light that penetrates an inch into the tissues versus a K laser that might penetrate 2 or 3 inches into the tissues.